Definition: Antifrost is affinity measures antibody agente titer indefinite receptor Sander investigate.
Reddening of the skin. Alright. Lupus is Latin for wolf, so affects multiple organs, wolf, reddening of the skin. Not exactly. The modern use of lupus usually refers to a variety of diseases that affect the skin, which was possibly originally used since these diseases resemble a wolf bite on the patient's skin. Is that true? Who knows? At any rate, systemic lupus erythematosus, or SLE, sometimes just lupus, is a disease that's systemic and affects a wide variety of organs, but notably often causes red lesions on the skin. Alright, but how does lupus affect all these organs? Well, usually the immune system protects the body's tissues from invaders, but lupus is an autoimmune disease, which means that the immune cells start attacking the tissues they're supposed to protect. With lupus, essentially any tissue or organ can be targeted. And just like a ton of other autoimmune diseases, it's not completely clear why it develops. And like most diseases, it's the result of both genetics and the environment. Alright, so let's go over a specific scenario to show how this usually plays out. Let's say that this guy has susceptibility genes that make him susceptible to getting lupus. And he's exposed to UV radiation in sunlight, which we know is an environmental risk factor for lupus. Well, given enough UV rays, think like sunburn, the cell's DNA can become so badly damaged that the cell undergoes programmed cell death, or apoptosis, and it dies. This produces these tiny apoptotic bodies and exposes the insides of the cell, including parts of the nucleus, like DNA, histones, and other proteins, to the rest of the body. Well, those susceptibility genes specifically have an effect on this person's immune system, such that their immune cells are more likely to think that these are foreign, or antigens. And since they're from the nucleus, we call them nuclear antigens. And those immune cells try to attack them. Not only that though, susceptibility genes also cause this person to have less effective clearance, essentially meaning that they aren't as good at getting rid of these apoptotic bodies, and so they end up having more nuclear antigens floating around. This means that B cells might swing by, see them, and start the production of antibodies against these pieces of nucleus, which are called anti-nuclear antibodies. And these guys are present in almost all cases of lupus. Alright, so those anti-nuclear antibodies bind to the nuclear antigens, forming antigen-antibody complexes.
Application immunology. Application immunology advocate response research result A may more to 7.
Systemic lupus erythematosus, or SLE for short, is an autoimmune disease mediated by autoantibodies and immune complexes which target nearly every organ in the body. SLE is a chronic multi-system disorder that most commonly affects women during their reproductive years. The pathophysiology of SLE involves injury to the body's own cells, leading to damaged cell proteins and their DNA. Injury to a group of cells can subsequently lead to organ injury. The pathophysiology of SLE is thought to involve an interplay between genetics. For example, SLE is seen in monozygotic twins, and there's also influences of epigenetics, immunology factors, hormonal factors such as estrogen, and mainly environmental factors. Environmental factors is thought to be the initial trigger for SLE. These environmental factors include UV light, infections such as Epstein-Barr virus, smoking, and even potentially certain drugs that increases oxidative stress, damage that will lead to the cells being damaged. Important to note that these environmental risk factors are agents which humans are commonly exposed to, suggesting that people who develop SLE have to have some sort of genetic susceptibility. When cells are damaged, they can try to repair themselves. If they can't, they undergo
Aposacons species with a fifth active of the interfere of the cause student reduction in glucocorticoid error.
Discuss lupus, more formally known as systemic lupus erythematosus, or SLE. Lupus has a unique pathology. Basically, this is a multi-system inflammatory autoimmune disease that's caused by immune complex-mediated damage. It affects multiple organs in different ways in different people. And the cause is unknown. There are genetic factors, environmental factors, and hormonal factors which mitigate the disease. It is more common in girls than boys, and the peak pediatric age of diagnosis is 9 to 15 years of age. We don't usually see it in the very young children. So the pathophysiology of lupus is, as we stated, both genetic and environmental. In a susceptible individual who has susceptibility genes, they're going to have an event that results in an apoptosis. For example, they might get a sunburn on their skin, a UV radiation, a period during which cells are breaking down on a larger scale. These patients, because of their genetic susceptibility, will have a defective clearance of these apoptotic bodies, resulting in an increased burden of nuclear antigens throughout the body. In this susceptible person, the B cells and T cells will mount an immune response against these nuclear antigens. This will create anti-nuclear antibody antigen complexes, which will then go through the body, going to stimulate both dendritic cells, which then stimulate B cells, and create antibodies vastly against nuclear antigens. These nuclear antigen with antibody complexes are causing the mainstay of the disease in organs throughout the body. So let's go through some of the basic symptoms of SLE or lupus. Constitutionally, these patients get frequent fevers. They may have fatigue, and they'll develop weight loss as well. Their skin has a few key findings. This girl has one of them, a malar rash. They may also have a discoid rash, which are little round circles around the skin. Discoid rashes are also common in babies with lupus, and we'll talk about that entity separately. Also, patients may get photosensitivity, which is an increased susceptibility to burn when exposed to the sun. Patients do get lung involvement.
Injury applied to Ecuador. Wet, rain, patching to receiving intravenous anifrolumab.
Hey guys, it's Medicosis Perfectionalis one more time. In the previous video we have talked about anti-double-stranded DNA, which happen to occur in lupus, and they are associated with lupus nephritis and vasculitis. Today we have a crazy mnemonic about anti-double-stranded DNA, so let's get started. Here is a list of my previous rheumatology videos, so make sure to subscribe and save my rheumatology playlist. As you know, anti-double-stranded DNA is a specific subtype of ANA because the DNA is in the nucleus. They are IgG autoantibodies against the double-stranded DNA detected by ELISA or immunofluorescence. Very, very specific for lupus, but they are not sensitive. Some normal individuals can have anti-double-stranded, as you know, and they correlate with disease activity, especially glomerulonephritis as well as vasculitis. So here is a blood vessel. But don't forget, they are absent in drug-induced lupus. Before I get to the mnemonic, don't forget I have 50 hematology cases available.
Conclusion. Morning and trends and affliction resulting in high presence of pains with a response I well 15 home placebo.